Incorporating multidimensionality. How should we define and measure poverty in the United States today? As a society, it is important that we are able to measure the well-being of individuals, groups of people, and geographical regions over time. On the basis of respecting the dignity of all, it is of concern that people are living minimally decent lives by having their basic material needs and human liberties met. From the historical measurements that we have, we know that as a world we have been able to reduce poverty significantly over the past century, and our current measurements of poverty have done a sufficient job at tracking that data. However, as we continue to improve conditions and tackle nuanced problems of an ever-evolving world, we must continue to reevaluate our definitions of poverty and our subsequent systems of measurement. As anyone who has spent any time contemplating the best way to accomplish an adequate measurement of poverty will attest to, this is no small feat. To help guide our definition and measurement, we have developed three key principles. Poverty should be defined and measured in a way that is used to help people. Poverty should be defined and measured with a focus on having basic needs met and by having the capability to have them met through reasonable effort. And 3, poverty should be defined through brackets or scales, not through black and white thresholds. Point 1. Definition. Poverty should be defined and measured in a way that is used to help people. Though it may feel obvious, it is important to keep in mind why we are interested in defining and measuring poverty in the first place. The foundational principle that we work upon is that all people intrinsically matter, and thus all people deserve to have the means to fulfill their basic needs. We are not simply trying to gather an accurate statistic. We must frame the measurements in a manner that identifies those with the greatest need, what their needs are, and how we can provide long-term solutions to their deprivations. In other words, we need more specific breakdowns than a yes or no if someone is in poverty. We need to know information about why someone is in poverty, which brings us to our next principle. Poverty should be defined and measured both with current needs being met and having social mobility or capabilities. We define poverty as the following. When one's basic material needs and minimal capabilities are not being met, without going into poverty and without being overworked. People need a minimum amount of material goods to be comfortable, clean, and healthy, and this includes the classic food, clothes, shelter, and utility, FCSU needs. In the modern day, we need other goods to survive as a part of society, such as internet access, insurance, and sometimes a personal vehicle. One should have the ability to obtain these goods without going into debt. Rachel Sheffield and Robert Rector suggest that our current measurement of poverty far overestimates the number of households in poverty today. While it may be true that most households in the U.S. do actually have their basic needs met, alongside access to some certain modern-day amenities, as he argues, he never mentions if these households are in debt to have their said basic needs. People also need a minimal level of socioeconomic equality, as granted through core capabilities. When measured properly, capabilities can measure social mobility. Social mobility is in part the ability to work one's way out of poverty. It asks the question, is one in poverty because of their own life choices, or is their situation beyond their control? And this is a vital question, especially when considering the dignity of all humans. If someone is in poverty due to circumstances beyond their control, we have a duty to address the institutions that make it so. And this ties in concepts of generational and cyclical poverty and hardships. In Dorothy Allison's memoir, A Question of Class, Allison describes many factors that kept her family generationally poor, those factors being from domestic abuse, a culture of crime, a lack of educational and employment opportunities, and a self-fulfilling prophecy placed upon them by society for failure. Her parents worked constantly, but no amount of work was going to save them from the situation they had been born into. Measuring capabilities is important as it is directly related to what causes and maintains poverty. For the capabilities framework, we concur with Nussbaum's 10 core capabilities and her reasoning why behind why they should be considered core capabilities. And we've placed them into 3 categories to make them more adaptable to measure material poverty. First, we have educational attainment, and these include the capabilities of thought, imagination, and practical reasoning. It is important to measure because people with higher educational attainment are statistically proven to be wealthier on average. In addition, education, as shown by Allison, is an effective way to break cycles of crime, abuse, and ultimately poverty. Education is also important for those who are struggling to be able to productively express why they are struggling so something can be done about it. We also included self-determination as defined through the capabilities of emotion, play, bodily integrity, affiliation, and having animals and pets. And although measuring self-determination is not strictly necessary for measuring material poverty, it does ensure that we are protecting the dignity of those we attempt to help. Lastly, we have health, and this includes life, bodily health, and bodily integrity. Individuals should not have to put their health on the line to attain a basic quality of life, nor obtain any other core capabilities. We also believe that a central capability, in addition to the core 10, falling under health, is the minimal amount of rest. People should not have to spend all their time working just to have their minimal needs met. They might have enough material goods, but if they attain those goods at the expense of their health, ability to play, ability to affiliate, and ability to interact with society, they do not have those material goods in respect to their dignity. Lastly, our third main principle is that poverty should be defined through categories. Many poverty systems already function this way, such as SNAP, housing vouchers, Medicaid, and Medicare, and these are prioritized based on percentages of the poverty threshold, with the greatest amount of benefits going to those who have the lowest income. However, Robert Rector does make a fair point that not everyone who is classified as in poverty is struggling to the same extent. For example, with the current OPM and SPM used by the United States, we have a single dollar amount threshold that labels somebody as either poor or not poor, based on whether or not their income is above or below that dollar amount. It is obvious, though, that someone who is making $1, $10, or even $1,000 above the poverty line, who is not considered poor, does not have a significantly different quality of life or access to basic needs as someone who falls just below the poverty line. In fact, depending on the situation, they may be worse off. The person who is not poor may be worse off than the person who is considered to be in poverty, which is not ideal when a cash threshold is being used as a proxy for quality of life. Even more starkly, to Rector's point, is that someone who is homeless and someone who is just below the poverty line are both classified only as being in poverty, which does not accurately classify the reality of these distinctions. Using our current system as an example, there should be a larger focus on defining percentage of poverty lines and estimating the quality of life of those percentages. This would give the public and organizations a better idea of how severe poverty is and how poverty severity is changing over time. We would also glean more information about where poverty is the most severe, and this concept could be extended to methods like the MPI as well, where total MPI scores are counted instead of only having a score threshold determining if somebody is or is not multidimensionally poor. So, with all of these shoulds, what would a measurement that incorporates all these factors actually look like? Our principles lead us to a measurement that follows a similar framework to the MPI, both directly measuring quality of life and capability functions. These are rough ideas with much room for debate and research about determining thresholds and item weighting, but an example of the US adjusted MPI would follow these 4 categories. First, we have health, and questions could include, is life expectancy blank or more years lower than national averages in this specific area or household? Are all necessary medications or appointments affordable without sacrificing FCSU needs or going into debt? And does the household have a freedom from domestic and drug abuse? Next, we have education, And these questions could be something like, is there anyone in the family who has not obtained a high school diploma or GED? And this question would have more weight than, for example, has at least one person in the household or immediate family received a college degree, which would have less weight. And then another question with potentially more weight than the college education question would be, is the closest public school safe, as in attending does not increase risk to bodily health? Next, we have quality of life, and these questions could be like, nobody in the family has to work more than 60 hours a week to provide basic FCSU needs. Is there always enough food available, even if it's not preferential? And then we could also have some form of measurement about the quality and cost of shelter and the quality and cost of utilities, which would require much more research. Lastly, we have self-determination, which is vital for capabilities. And these questions could be like, are eligible voters physically capable of voting, i.e. they won't be penalized for missing work, and they do have access to a voting center? Given reasonable planning and sacrifice, would the household be able to move to a different city, for example, for more opportunities? And then finally, we have, are all members of the household able to fulfill their identity without the fear of being discriminated against, whether within their family, community, jobs, etc.? Again, these examples are just a few of many possibilities, but implementing multidimensional measures on a national scale is vital because it will provide more accurate data about who is in poverty and why they are, making it more effective for poverty solutions. It will also allow us to check correlational data, identifying the accuracy of income, such as our current OPM and SPM, as a proxy for equality of life. It will also incorporate measurements of social mobility, social justice, and dignity into our concept of poverty. And multidimensional measurements can also easily be made into brackets to track severity. With that being said, rather than overhauling a current system, it would be best to incorporate a multidimensional measure alongside our current OPM and SPM. The United States is a very money-centric society, so people intrinsically understand and accept poverty measurements that are based on money. In addition, the OPM and SPM still do provide valuable historic data, and the SPM in particular has been fine-tuned to make cash a decent proxy for the threshold of a basic quality of life. Even so, if we incorporate a capabilities measurement alongside our cash measurements, we may, with time, be able to phase our societal understanding towards a more valuable capabilities approach. No definition nor measurement of poverty is without flaw, but by incorporating a capability-centered approach into our pre-existing cash proxy measurement, we can attain a fuller picture about what poverty looks like in the United States, how severity is changing over time, and what institutional investments or changes we can make to continue to improve it.